Hello, everyone, and welcome back to the blog. One of the many things I'm proud of is our reputation as a learning organization. And you've all helped build our culture of learning and innovation, which has been serving us so well during this pandemic. It's allowed us to be nimble and adapt our provincial response to COVID-19 as needed. And as we continue to see outbreaks across the province, it is clear that the health risk posed by this pandemic is not going away. Our ability to learn helps ensure that we can adapt consistent best practices across AHS and that we have the supports in place to continue to limit the spread of COVID-19 in the months ahead. To that end, much work has been done by our Provincial Acute Care Outbreak Prevention and Management Task Force to understand how best to reduce the risk of an acute care outbreak occurring while ensuring our response is carried out efficiently and effectively. So joining me to talk about COVID-19 outbreaks, how we've responded, and what we've learned are Linda Iwasiw, Interim Chief Zone Officer for South Zone, Dr. Dave Zygun, Edmonton Zone Medical Director, and Dr. Peter Jamieson, Medical Director of Foothills Hospital and Associate Calgary Zone Medical Director and Medical Advisor for the AHS Emergency Coordination Center. So welcome to all, and thank you so much for being here. Peter, I'm going to start with you. We know that you've had an outbreak at Foothills Medical Center. So maybe just share with us what that experience was like.
Yeah, thanks, Verna. In keeping with many sites in the province, we've had, unfortunately, outbreak and watch situations. And we had a cluster of outbreaks predominantly on our cardiac wards in September and October. I'm very pleased to say that those outbreaks have now closed. But of course, we did see significant impact to our patients and families and to our staff. A number of folks became ill, and a large number of staff had to be excluded from work. So it had a very significant impact on the people who work and who receive care in those environments. And it required a lot of work on the site's part to rearrange services to be sure that we were providing what people needed.
My understanding was that at one point you actually had more than 300 staff actually off work. So that's a huge impact, right, for just one site alone. And so when you sort of look back, and we know that hindsight is 2020, what could you have done differently or would have done differently?
Yeah, so the cardiac unit outbreaks taught us some really important lessons. The first and most important lesson is that the public health advice around hand hygiene, wearing a mask indoors, maintaining physical distancing really, really matters. And at this point in the pandemic, I think we're all a little bit tired of hearing it, but no matter how fatigued we are, it's still really important. Another important factor is just simply the obvious: don't come to work if you're sick. And so we've poured a huge amount of effort into education around using the Fitness for Work tool, and on Outbreak and in watch units using the expanded symptoms. The tool now supports that. And as we see other watch situations around the province, the most common reason for that is that a staff member came to work feeling well, but then developed symptoms while at work. So another important lesson is the need to be vigilant about asking yourself those questions every 4 hours while you're at work. And if you start to feel that tickle in the back of your throat, a loss of sense of smell, general malaise and headache, you need to really pay attention to those and to act accordingly. And then the final, probably the most difficult lesson that we've learned, because it's so operationally complicated, is the need for continuity of isolation precautions. So when patients are on watch and outbreak environments and move around the hospital, are discharged home, move to another facility or interventional area, their precautions and sometimes their serial testing needs to follow them. And that really requires the engagement of many, many members of the team. And it requires everybody to have their thinking caps on all the time when we move patients around.
So Linda, coming to you, we know that the Chinook Regional Hospital recently declared an outbreak. So what do you want to tell others who are actually going through an outbreak right now?
So what we learned at Chinook Regional Hospital in the South Zone is how quickly a site, and for us, this is a regional hospital, can go from day-to-day operations to a whole site that's on outbreak. So it doesn't have to occur sequentially from unit by unit or department by department, which I think is one of the pieces that caught us a bit by surprise, because I think our learnings and our expectations is that we would start what I would call small with a unit, and potentially it would progress and would not get to a site. So it was a bit overwhelming, I have to say, for the site when we went from yesterday we're business as usual with lots of activity to today we're in an outbreak. What would I tell others? Be prepared. Have your site outbreak response team leader and team identified and ready to go. Make sure that your teams are aware and orientated to our processes. And absolutely, our medical officers of health, our IPC team, and our WHS are our lifeline to work with our operations and medical leadership. Another thing I'd like to share is bring your response team together as soon as possible. The sooner the better, so that you can assess where you're at. You can manage the current, but be prepared for potential future. So that control and management, because it could get worse. For us, it could have gotten a lot worse as we began to do prevalence testing and close contact. It could have gotten a lot worse in terms of the number of individuals that may have been exposed, and therefore the consequences of that and the isolation. Depending on the situation, you know, I would say to others, move quickly to set up the team, but also potentially a site command post if you don't have it in place. Something else I would say to the group is make sure that you're using the acute care outbreak response manual. Make decisions based on best practice. Look at the situation at the time, but always look forward. Always look at that notion of, yes, you're in outbreak, but the key pieces around prevention, control, and management of the situation. And as Peter has identified, some of the things to make sure that we pass on to our colleagues are in that manual and those processes. Cohort your healthcare workers as soon as possible. If necessary, cohort your patients. Decrease the transfers and patient movement within the site and between facilities as much as possible, and decrease the flow into the site as much as possible. And ensure that your PPE practices are diligent and you've got your coaching pieces in place. And contact the SWAT team to provide support to the team. The last, one of the other pieces is communication. And we learned this very much from the Foothills team. It's important to let the site know, both your healthcare workers, your patients, and your public, know what the situation is. Know that you're in an outbreak, know what restrictions are in place and why. It's critical for them to all know that it's a safe place to work and to receive care.
You mentioned a bit about the SWAT team, which is the Acute Care Outbreak Prevention and Management Task Force. And can you tell us a little bit more about that group's work and how they helped you in your outbreak?
The SWAT team is set up as a provincial resource with provincial experts to support the site and or the local team who are managing the situation. And they're really there to support and provide advice. And it's important for them to have the availability in the initial and ongoing management of the COVID team to support that local response. So their duties are to be there, to be available within the first 24 hours to meet with the site team. And usually it starts with the operations and medical leadership of that team. Then they're available for a second meeting to follow up with the team. And it can be just the medical and operational leads, or it can be the whole team. It depends on what the site requires. And then they're there for ongoing support and to help debrief. We have members provincially that have been identified, and they're experts in their field in the areas of operations and medical leadership, HR and LR, WHS, IPC, MOH, and communications. Others can be added as needed. The feedback that we received was that the connection was invaluable and that the ongoing support, pick up the phone and call the next day to get some further guidance, or even just confirmation that some of the actions that they were implementing in terms of contact tracing and surveillance and some of the visitor restrictions, et cetera, were the right thing to do. So it was very, very reassuring to the local team who knew what they were doing, but a lot of it was that reassurance because we were in a site outbreak, something that we had not experienced before. So the connection with that provincial team, the feedback that we received from the local team was absolutely invaluable. And we are so proud to be able to be part of and have that connectivity, both at a local, but more importantly on a provincial basis.
So Dave, we're going to come to you. I mean, I think we've all alluded to COVID fatigue and everybody's really tired of it. But Peter made a very good point, right? It's here and we're going to have to deal with it. So, but we are very cognizant of the impact on our staff. So why don't you share with us some of the ways that you've used to support our people, frontline and leadership who are working at the sites with outbreaks?
I think there are many ways, but let me highlight a few here and want to pick up on your comments about being a learning organization. I think that the many players that Linda has mentioned, workforce health and safety, IP&C, MOH, site leadership, we've all got to come together quickly and have clear communicated messages of what's going on through our sites and through the zone so we can respond and care for patients. And I think that that's been a huge benefit of us as a provincial organization. So very early on, we set these. I can tell you, we saw the learnings from the Misericordia being immediately transferred to the Grey Nuns. Even though we dealt with major outbreaks, we listened intently to the experience at Foothills and learned from their experience because every site is different. But having those clear messages to our staff and leaders, having that clear guidance and bringing all the perspectives together has been a major learning and advantage to being in this. I'll highlight a couple other examples as well. We know that PPE fatigue is a major challenge for all of us. Those that wear this for 12 hours on a shift and have raw noses and raw ears as a result, we understand. So how can we ensure that our staff are safe? So one of the ways that we have progressed, and now at most major sites, and certainly all those with an outbreak, is to have PPE coaches. Even many of us who are experienced in donning and doffing, we know the errors and breaches can occur during that process, putting on and taking off. So having our peers trained in the exact procedures and then supporting each other is a major intervention that clearly received rave reviews from our staff and leaders as a way to prevent breaches. I think the other one I'll highlight of many advances is the recognition of these challenges to our staff, not only PPE fatigue, but the stress of coming to work, dealing with COVID, both in the community and at their work, and having to step up in these stressful times. Our mental health experts came together early on in our first major outbreak at the Misericordia. And through various interventions and recommendations, we've been able to support both sites and zonal programs to help our staff and leaders. And this may be things like town halls, debrief sessions at the sites, and various other techniques to do our best to both recognize what our staff and leaders are going through and help them through that.
So what do you think are some of the best ways for us to prevent or contain outbreaks, since we have had now quite a few in our acute care facilities and we're trying to learn from them?
We know that one of the major issues is people coming into our facilities with symptoms, and that certainly can be both visitors and staff. But as staff and physicians, we really do have to monitor. I also understand that there's great pressure. You want to come in and provide the care. This is what we're here for. You also don't want to be away and put burdens on your colleagues who now have to cover. But we've said this all along, we're all in this together, and we have to make sure that we're self-monitoring and not coming into work. I'll also highlight that just like everybody else out in society, we have to follow those public health guidelines that many of our staff are being exposed in the community. And so listening to Dr. Henshaw and all the public health recommendations is so important now to both protect ourselves as citizens, but also to protect our institutions.
A final question for each of you. What's the biggest thing that you've learned from your experience with outbreaks? And Peter, I'm going to start with you.
The biggest thing that I've learned from managing these outbreaks is you cannot communicate enough. People are very on edge and nervous about coming to work when they know that there's an outbreak. They need lots of factual information. They don't need panic, they need planning, and they need the facts. And so we've really been working to refine that.
Linda, you're next.
So the biggest thing that I think I've learned or we've learned is act fast and act correctly. The teams need to know and that that we have their backs, that we are confident in the plans. We have incredible teams. They know their work and we're there to support them. And they need to know that it's a privilege to work with them and support them, providing care to our patients, and how proud we are of them.
Thanks, Linda. And last but not least, Dave, what's your number one takeaway?
The number one takeaway is to reach out for help. We now have the task force that'll bring the collective experiences. Again and again, we're asked, have we learned from this? Unequivocally, the answer is yes, and we get better with each one. So although your site and the outbreak may be unique, there is probably someone who in this organization who has experienced something similar. And the solution may not be exact, but you will benefit from their expertise, and it's there for you. So please use it.
Thanks to all of you for coming on today. Outbreaks and the pandemic in general has really tested our resolve these past few months and will continue to do so for the foreseeable future. But I know that whatever comes our way, we are going to get through this because we have each other. So let's continue to support one another, learn from each other, be kind to each other, and encourage one another as we always have. I'm very proud and honored to be part of this extraordinary team. As we all know, healthcare is a team sport and we are all in this together. So thank you for everything, and I'll see you next week.
Together, we do amazing things every day.